Inside the eukaryotic cell, we have many different parts and organelles similar to a gym and the different machines. Different ions in the cell function to support and determine resting and action potential. These ions go through the cell using carrier proteins, which is represented using the door. The flow of the ions in or out of the cell is determined by the electrochemical gradient, and many of the ion channels use the synthesis of ATP to transport the ions. Chloride is moved into the cell using an intracellular ligand-gated channels, and sodium and potassium are carried across the membrane using voltage-gated channels. The ionic concentrations are essential for the functions of the neurons. If it weren't for the ions, work inside the cell simply wouldn't be possible. Our bodies would not function without ion channels to maintain membrane potential and action potential.
As we make this pre-workout, we will explain how the cell makes CFTR. CFTR, or the cystic fibrosis transmembrane conductance regulator, is responsible for transporting the chloride ion in and out of ion channels in the body. Without it, someone could be diagnosed with cystic fibrosis. CFTR is transcribed into mRNA inside the nucleus. After splicing, the protein is synthesized in the cytoplasm to the ER. The CFTR that makes it to the Golgi is then directed to the cell surface, and at the surface, it transports chloride ions across epithelial cell membranes.
In a normal cell, a chloride ion cannot enter or leave the cell on its own, so it needs assistance from the CFTR. Shown here, the CFTR is spotting a chloride ion in a lift it could not complete without help. A normal functioning CFTR channel moves chloride ions to the outside of the cell. However, a mutant CFTR channel does not, causing sticky mucus to build up on the outside of the cell, which is problematic for normal lung function. A genetic mutation causes malfunction of the CFTR. In some instances, as shown here, a proteasome degrades the CFTR, which inhibits the function of the chloride ion.
A person without cystic fibrosis can recover from exercise easily due to proper electrogradients, action potential, and lung function. But a person with cystic fibrosis struggles with day-to-day activities such as exercising due to mucus blockage in the bronchial tubes, the digestive system, and other organs. Instead of the fluids that normally lubricate the organs in our body, the secretion is thick and sticky. Cystic fibrosis patients suffer from asthma and other breathing problems. They are also predisposed to excessively salty sweat. The normal life expectancy is 30 years of age.
Patients also suffer from heart arrhythmia causing irregular heartbeat.